Okay, so we're moving on to rodent and rabbit anesthesia, kind of exotics in general. Um, One thing, and this is chapter 12, and you should have received the PowerPoint. This is a very general overview of some exotics and some principles of anesthesia. If I know a lot of people are interested in exotics, and if you do go into exotics, you'll get a lot of individualized training. I always refer to Niemer, obviously, because when I did anesthesia at Purdue, we had a technician that kind of did our exotics. So I didn't work with them a lot, but there are some basic principles. Because I will say that there are some veterinarians, if you go to work in a general practice, there are some veterinarians that actually will see some rodents, some ferrets. They may see a rat. Some people dabble in birds. You know, obviously Niemer worked at a specialty exotics practice, but I have worked with some veterinarians over the years that were willing to see exotics, and some were like, I won't see them whatsoever. I did work at Circle City when we were the only emergency clinic that would see exotics. So we get some basic training. So I will say that there's definitely some considerations, and everything always starts with patient history, patient evaluation. Sometimes getting a good history is difficult. I mean, if this is the rabbit that lives in the daughter's room and the parents never see it, if somebody gets it because they think it's cute, they don't know a lot of information. So one thing that I try to do, well, and also shorter lifespan, like 3 years old for a rat is very, very geriatric. You know, a 3-year-old dog or a 3-year-old cat should be a very healthy adult. So you have to understand the lifespan, and obviously birds can live very long and live up to like 20 years. So understanding the species that you're working with, understanding their lifespan, common diseases. When they are brought to the clinic, one thing that I try, or it's useful, is having the owner bring the cage. Now, if it's a very big cage, that might be difficult. But one thing is, a lot of assessment on exotics is going to be done from just straight observation, because they get very stressed when they're handled. So if I'm going to go do a physical and then the doctor's going to get them out, we're getting them out twice. It's much better to say we're going to get them out one time. I do the same thing for stressful cats, aggressive dogs. We're not going to handle them more than we have to, and I kind of treat exotics this way. So look for their bedding. Obviously also transportation is stressful. So that's a concern, is getting them into the hospital. And then what you want to do while I'm talking to the owner, now whether it's in a cage, a box, whether it's in their arms, is observe their normal, how are they behaving and how are they breathing. And again, you do not need to handle them to take a respiratory rate. You can observe respiratory effort, look at their nostrils, look at the appearance. Is there any ocular discharge? Stop. Is there any nasal discharge? Is there any coughing? Is there abdominal breathing? What is their hair coat like? Is it, sorry, my dogs are wrestling in the background. Is there any, some thing is like, if you look near their perianal area, is there any soiling, matted fur around the rectum? Anything that's going to lead you to, like, because they're very fastidious. They like to keep themselves clean. If you see a rat, a mouse, a bunny, and they look very unkept, that can be a sign that they have an illness. But you want to do as much observation from afar because of their stress level. And we want to be very careful during restraint. One interesting thing about birds, because there's not a lot of bird stuff in here, but verbally I'll tell you, we never got a bird out of its cage in a big open treatment room where the bird could escape or they could fly into a vent. So we usually tried to take a bird into a very small exam room if we were going to take them out. That way, if they escape, they're in a smaller area. The same thing is like if you're going to lose a rat or a mouse, if you're in a small exam room, it's going to be a lot easier to find them than if you take them to your big treatment room. So, and you guys have gone over principles of restraint and exotics. So definitely you should know safe handling. There's some notes here underneath that says also if you've been holding dogs and cats and then you go to hold a rabbit and they pick up on that scent, they can get very stressed. So try to remove, maybe wear a lab coat that's only for exotics or that you're not wearing with your dogs and cats. So once we do that, and then a lot of times you're going to have to give injections. Now, normally, I know, I'm talking with Nemur, a lot of IM techniques are done, inhalants, but IP, if you're going to work in research, we did this at Purdue, we used an IP protocol to anesthetize our rats. And you're given an injection intraperitoneally, and it's going to be absorbed in the peritoneal cavity. This is always done in the right lower quadrant. And what you definitely want to do when you give an IP injection is you want to typically hold them almost like tipped upside down so that the abdominal contents slide forward. Okay, so you want to like try to avoid. IM injection is going to be best done on the cranial, the quadriceps. Stop! Get out! Go! Okay, that's going to be better done here. And then usually on the right side, but if we have a rat, the injection is going to be done on the left side because of their large cecum. So we don't want to inject on the right side. Other species will be on the right. Now, you can do IV in a rat. If it's a large enough rat, you can catheterize their tail vein here. And this yellow is a universal color for a 24 gauge catheter. So all 24 gauge catheters are yellow, no matter who makes them. And that's a very, very small catheter. So you're not going to get a lot of drugs or fluids through it, but you could do enough of an IV injection. And it runs on the ventral medial aspect of the tail. And it's going to be better visualized up above. So that is possible, but most of the time in the rats, you're going to use like an IM, IP, or an inhalant protocol. Not going to use a lot of IV anesthesia. It's hard to see the vein in this picture. Okay. Now, some handling and restraint. Hamsters and gerbils, very quick. And one thing, and Nemur's probably gone over this with you, but when you go to grab them, you have to be very quick. And a lot of times these guys are going to freeze. And you kind of let up because you think, oh, they're relaxed. They're not moving. And then the minute you let up, they're going to want to dart. So you want to always make sure you have firm restraint. You want to be with, hamsters and gerbils like to escape. And then guinea pigs, you have to be very quick. I always laugh, and I really like guinea pigs. So I'm not a huge mouse and rat fan. I'm trying to warm up to all Nemur's rats in the office, but guinea pigs, if there's multiple ones in a cage or like a herd, and they can stampede into one area. So you have to be very quick when you grab them, and they're either going to freeze or they're going to scream. They kind of do one or the other. So again, one thing, when you go to deal with rat, mouse, hamster, gerbil, guinea pig, whatever, you want to have everything ready. You don't want to grab a guinea pig for an injection and nothing's drawn up or the person's waiting on you. So I'm not even going to get them out of their cage, to draw blood, to do anesthesia, if I don't have anything ready to go. So you want to have all that ready. have your injections ready, have your machine, your oxygen, all set up. Okay. And this is showing a hamster. So similar, this is an IP injection, and it's going to be in that quadrant. Now, one thing to let me tell you, when you use IM protocols, when you use IP, these are not titrated to effect. You're going to pick a dose. You're going to give it all that you calculate, and it's going to take, IP and IM are going to take, could take 20, 30 minutes to kick in. It really depends on the condition of the animal, how excited they are, your dose, but it's not going to be like IP in 5 minutes, they're out. So the nice thing is when you give them the injection, you put them back in a little cage, you can get your stuff, the rest of your stuff all set up. Use that time wisely. But again, IM, IP are not bolus techniques. Now, probably what you're going to work with more or have the chance to would be rabbits, because a fair amount of people have them, and rabbits, they're going to have a little bit longer lifespan, and people are more willing to do procedures. I actually, what the funny story is, we radiated 2 rabbits. Now, radiation costs $5,000-$6,000. I radiated 2 rabbits. And the funny thing is Nemur was one of the techs, so the exotics techs would bring them, and they would anesthetize them, and we would do the radiation. So I never did the anesthesia. They always did the anesthesia, and I did the radiation. But the big thing with handling rabbits, and I know she's probably told you this, is, you know, you're definitely going to want to, you can grab the skin over the shoulders, you can hold them underneath their neck, but you have to support their back legs because they're so strong. We had a research study at Purdue, and we used the large white rabbits, and there was a research tech that grabbed the rabbit, didn't have the back end, it kicked and it broke its back and had to be euthanized. So it does happen. It's, you know, the bigger they are, the more of a chance that you have. So you want to grab them underneath. You can do this kind of swaddle wrapping technique. Now, I would not wrap them up and then walk away. I mean, you know, you still want to have that, but they're going to feel more secure. Their legs are going to be secure. This would be great if you were doing a catheter. You could pull out one leg out of this little burrito and work on the catheter. So that's a good technique. But you want to support the back. And then injection sites. They have a decent, you know, you can use the cranial thigh muscle, which is the quadriceps, semimembranosus tendinosus. The apaxials are going to be probably kind of small, unless it's a bigger rabbit. And so those, and then of course, we're going to talk about venous access. If you want to go IV, you can definitely do that. Now, this is showing what's called, so this is very tempting, this artery. That's not what you want to do. We're going to do the marginal ear vein. So we're going to do the vein that's, now it's showing on this middle ear, but the preferred vein is this one on the edge. Kind of similar to swine. You can put the catheter in. It's very superficial, so don't do this. You're going to go through your finger. And then what you do is you put a little roll of gauze and then tape the ear. AJ, stop. Then you're going to put the tape around the ear. So you can, now, you're definitely going to want to definitely sedate them before you do a catheter, unless they were very, very ill, because they're very excitable and very prone to stress. So I don't recommend trying to put this catheter in with them without any pre-meds on board. But the other thing that's not in this picture is, now their front legs are short. You can do a cephalic. You can put a 24 gauge in a cephalic. The saphenous would be a little difficult, the lateral saphenous. And you got to be careful, because if you put them on their side, then their feet are out and they can kick. So if you don't have them supported, they could potentially break their back laying on their side. So you got to be really careful. I like them when they're sternal because then I can kind of push them into the table and they can't kick their legs. Once you lay them on their side, they can do a lot of kicking. And it talks about the cephalic vein, the saphenous vein for venipuncture. One thing I also want to mention, and again, I'm not trying to, Niemer's probably told you this. When I carried rabbits, I always walked with them backwards with their butt facing out, their head tucked under my arm. I don't know if you're large animal people and if you have horses, there's a thing in horses where they're called barn sour. Like if you're coming back after a trail ride and your horse sees the barn and they take off because they want to get back to their barn. Rabbits are similar, is that if they see their cage, sometimes they leap. So if I walk backwards and tuck their head, first of all, they're not going to see a dog or a cat or get startled, and they're less likely to leap into their cage. I might just kind of like slide them in backwards. So that's, if I'm carrying a rabbit, I tend to carry them backwards, but first, so that they don't dive, and also again, if they hide, they're they're not going to be stressed. Now the same thing for the small mammals or a rabbit or a guinea pig. Observe them first before restraint. Obviously, getting a very accurate heart rate and respiratory rate is difficult. First of all, it's very fast. Second of all, these guys are stressed, so it's probably going to be elevated. So you really want to look at effort. Is there any abdominal effort? Is there any flaring? I forgot to mention flared nostrils. When they are in respiratory distress, now sometimes when they're stressed, their nostrils flare, but do you see exaggerated nostril movements, nasal discharge, open mouth breathing would not be normal. Rabbits are obligate nasal breathers. So if they're opening their mouth to breathe, it's not a good sign at all. Now for the heart rate, you can try to listen. You can maybe sneak a stethoscope in there, or just try to put your finger there and count. But again, we're talking heart rates that are going to be very elevated up in the, 250 to 300 range. A mouse is not countable. It's just super, super fast. So I want you to be very familiar with slide 12, because this talks about how do we know something's wrong with them. And I've talked about discharge, ocular discharge, nasal discharge. The other thing is, do they have bedding matted to their nose? And that's sometimes they've had nasal discharge, and then the shavings will get stuck there, and that's a sign that, normally they're good about cleaning themselves. And if you've got a bunch of matting here and bedding and, blowing bubbles, how are the respiratory sounds? Are they loud? Is there effort? And again, I told you about that perineum, which is right near, the anal opening and the urinary opening. Is that area? Now, some of them will be soiled just because if they have a lot of fur back there, or if they're white. But if it's matted, excessively soiled, odorous, sunken in eyes too. These guys, a little bit of dehydration goes a long way. So we really don't want to get them dehydrated. Their eyes are going to get sunken in fairly quickly. And then also feeling the vertebrae and the bones of the pelvis. Now, it can be that they were just a thinner rabbit or a thinner rat, but normally, we don't want to feel those bones. If you can outline the whole bone, like the scapula and the dorsal process, then that can be detrimental. And a rabbit, you can probably do a capillary refill time. You could lift up enough of their gums. It's going to be harder in a guinea pig and in a rat to look at capillary refill time. Sometimes what works is I'll take not the pen with the pen part sticking out, but you could take the end, try to lift up their lip, and can you see any color? So at least you could get a mucous membrane color. possibly a CRT. It just depends on how big they are. Now, as far as diagnostic tests, and this can be challenging because drawing blood on them, if they're very awake, young, healthy, excitable, blood tests may have to be done after they're anesthetized. Now, you can draw blood on a bird from the wing vein, so they may need sedation. So I would say in blood tests, you can do birds, rabbits. It's going to be difficult in a rat, possibly a guinea pig. Now, urinalysis. Definitely can do that on all of the species, palpate the bladder. The other thing, and this is kind of a little practice tip that'll help you. If I have a dog that pees on the floor, if I have a cat that urinates in a carrier, I always get a syringe and suck it up. Well, and on a dog, if they're there for urinary issues. But if you have these guys and you have the crate, now, obviously, if there's issues, we want to get a clean urine sample, but sometimes when they pee in the cage or the crate or the carrier, then they're going to have an empty bladder, and that urine is better than nothing. So a lot of times with these little guys, if they bring the carrier, I might soak up a little urine, because one test, I know I'm doing this by myself, I wanted to ask a question, but nobody's with me right now. One test you can do on a UA that is helpful is a specific gravity. And what's that going to tell you? Kidney function. It's an indicator of kidney function, because the more concentrated the urine, the kidneys are functioning. If you have non-concentrated urine, there's a chance that the kidneys aren't doing their job. So that's an easy, quick, if I can't get a kidney blood test, why don't I run a specific gravity? So again, I don't need a clean urine to run a specific gravity. If I want to do a culture and look for bacteria, I need a clean urine. But for like a specific gravity or to check for glucose in the urine in the cage is fine. The urine on the floor is fine. So suck it up before you clean it up. Radiography. Now, you can do radiographs in these guys. They're not always going to be the prettiest films. I know you guys are in radiology rotation right now. Sometimes, like one night we had a very sick, I think it was a guinea pig. Yes, it was a very, very sick guinea. Came in super, super swollen. And it was feeling pretty crummy. The doctor says, I just want one x-ray. Literally, I put it on the x-ray table and I put a piece of masking tape over it. And then I stepped out of the room and hit the button. I had a little window and he wasn't moving. You got to be very cautious. But sometimes in these guys, you can literally like tape these guys to the table. Restraint, you got to be very careful. I will tell you, this applies to any species. Nothing is worth stressing a patient for a radiograph that's going to result in its death. I've had respiratory cats code while we were trying to get an x-ray because the cat was in respiratory distress. We took an x-ray and you can almost kill the patient. So again, you don't want to stress them to the point where you're going to hurt them. You don't want to damage a limb. You don't want to stress them. Definitely going to potentially need some sedation, but tape is good for these guys. We used to have wooden spoons to help like hold wings or hold legs. And so there's like techniques you can do to get radiographs done. So you're going to try to get a workup, but I will tell you, there's going to be times you guys are going to have to sedate and then draw the blood, which again is not ideal, but these guys make it challenging. And sometimes that's the best you can do. Food and water. I am not, the general rule is we do not withhold food and water. And this is another time I'd like to ask a question. Why? These species have an extremely high metabolism. Okay, so they're going to burn through food. If you hold food for 12 hours, there's a good chance you're going to make them hypoglycemic. So usually food is going to be fed up until they get to the clinic. This is always doctor discretion. So you're going to want to default to what your doctor says. But in general, you do not need, no. Stop, AJ. In general, you do not need to withhold food. Okay. Now, if the stomach's involved with surgery, you have to empty the stomach, open the stomach, that would be different. You might do a 6-hour, 12-hour fast, but I just want you to know overall, I want you to be able to tell me they have a higher metabolism, we don't hold food. And then usually we try to feed them very quickly after surgery. So in general, I didn't talk about that in dogs and cats. In dogs and cats, we usually wait till they're a little more awake. But in these guys, the minute they're kind of sitting up, food is usually put in with them. Now, also realize, is it a nocturnal species? So you might feed, it might be during the day, and you give them their food, and they're not eating, and you might be like, I'm worried they're not eating, but this may not be when they eat. So that has to factor in whether they're eating or whether they're not eating. One thing that I also want to tell you is, well, and there's also a note on the side, is you don't usually withhold the food because they do not vomit. Rodents and rabbits do not vomit. But the other reason we don't withhold food is we don't want them to be hypoglycemic. So sorry, I got to mention that too. So we're not worried about vomiting like we would be in a dog or a cat. And one thing, I'm going to talk about how do we know they're painful after surgery. Well, sometimes they're painful. Actually, hold that thought. Okay, so normally we look at appetite as a way to tell if the animal is painful. So if they're not eating, that they may not be eating because they're in pain, or are they not eating because they're nocturnal? So again, there's going to be some assessments to do to determine pain, nocturnal, not eating, but general rule, make sure they have food. And the other thing I should mention, is that make sure the owners bring some of their food. You know, your clinic may keep, if your clinic works with rabbits and rats and guinea pigs, like at Circle City, we kept some exotic foods because if we got one on emergency, we needed some different foods. But in general, when owners called, and if we thought they might have to stay, I always said, please bring some of their food, because if they don't want to eat our food, we want them eating. So always try to get some food from the owners as a little tip. And then if you can, the same issue, can you give them any sub-Q fluids? Correct any pre-existing problems. Oxygenation and fluids are the big things I think of that are going to help them for anesthesia. And again, depending on their species, you know, in a rabbit, we can go IV for fluids, we can go sub-Q, and we can go IO, which is intraosseous. In a rat, we might do sub-Q or IP, and a mouse might do sub-Q or IP. A ferret could be sub-Q. A ferret can be IV. So, and a guinea pig would be sub-Q. So again, be familiar with some of the fluid routes that we have in the exotics. Now, this slide is controversial. Pre-anesthesia, it says sedation's rarely needed. It depends on the protocol you're using. If you're going with an IM knock them out protocol, you're not going to pre-med them and then knock them out. You're going to give everything in the muscle. It's almost like kitty magic is kind of the pre-med and the anesthesia mixed together. If I've not stressed that, that's kind of like you're not giving a pre-med and then giving kitty magic. Kitty magic is a pre-med induction mixed together. TKX in a pig is a pre-med and induction mixed together. So what they're telling you is if you're going to give something IP or you're going to give something IM, you're going to give the whole thing. You're probably not going to pre-med them. But if you're going to have a rabbit and you want to put a catheter and do an IV induction, then you're definitely going to want to pre-med them. You're not going to want to try to put that like I said, unless they were very, very sick, you're going to want to try to give them a pre-med before you try to put a catheter. And again, atropine, let me mention some drugs. And again, this is going to vary, but atropine, the reason we do it, now rabbits can produce some saliva, guinea pigs as well. The reason they give atropine really is not to elevate their heart rate. They've got a pretty high heart rate, is to decrease their secretions. The reason we don't use a pre-med of atropine in rabbits is because their enzyme that they have atropinase. And what happens is if you give a rabbit atropine, atropinase is an enzyme that breaks down atropine and makes it ineffective. If you give it to a rabbit, is it going to have a problem? No, it's just probably not going to work. So it's not like, oh my God, I give atropine to a rabbit, they're going to die. It's you're going to give atropine to a rabbit and there's really no point because it's probably not going to work. That's the reason. Now, if you have a rabbit in cardiac arrest or you have a bradycardic emergency, you're going to try to give it, okay? And you hope it works. You can also try glycopyrrolate, which isn't what we use in emergencies, but may have some benefit. So opioids, you want to give before induction and give it 30 to 40 minutes, especially, well, if you're going IM or IP, you want to give your opioids plenty of time to kick in. So at least 30 minutes before induction if you're going IP or IM. If you're going IV, it's usually 5 to 10 minutes before. And then sedatives or tranquilizers are typically either used as part of the induction protocol, or you're going to give these sedatives, like you might give a rabbit acepromazine and buprenorphine pre-med, let it sit, and then use like propofol for induction. You can do that. So atropine and glycopyrrolate are the anticholinergics, like I said. And again, the only reason you use these as a pre-med is, well, if you're worried about secretions, is the big one in these guys. Potentially, if you're worried about a drug causing bradycardia, although most doctors will wait to see if they're bradycardic and then give it. Acepromazine can be used. It's not going to give you immobilization. It's going to calm them or sedate them. Now, say for example, and I've always told you guys this, when you use ACE alone, you can get some sedation, but it has no analgesia. And if you use it alone, you have to use much higher doses to achieve sedation. It can allow you to maybe like draw some blood in a rabbit, put in a catheter, clip some nails, trim their teeth, clip their fur, clean their perineum. You see what I'm getting at? Some minor grooming type procedures, draw blood, maybe an x-ray. But if you're going to do anything painful or surgical, you're going to need to add drugs to that protocol. Now, one interesting drug that I've told you in cats, remember I said normal healthy cats, you don't give diazepam. Well, diazepam has to go IV. Midazolam, I don't use as a sedative unless they're very old or very sick, because if they're normal and healthy dog or cat, it actually causes excitement. But it works very well in exotics. So midazolam is used a lot. And actually, it wasn't until Nemur started working at the school, we were talking about anesthesia, and she mentioned they use intranasal midazolam. They drip it in, and when they inhale it, it works really well. And I thought that was very fascinating. And so that's something that you would get training on. You know, midazolam is a sedative. How you give it is going to be different. Again, midazolam is typically, you can go IM, IV, sub-Q, and now I just told you you can go intranasal in exotics. I've never used intranasal midazolam in a dog or cat, but in an exotic, sure. But it is more of a reliable sedative. Remember, IM muscle midazolam. So if I ask you which benzodiazepine is a reliable sedative in exotics, you would tell me midazolam. Now, the alpha-2s, we've got them all listed here, xylazine, medetomidine. The one you're using currently available is dexmedetomidine, which is dexdomitor. I don't think they have medetomidine anymore. They've reformulated it. I really need to take that out of the slide. And then xylazine is just the older, it's been around a long time. We tend to use more in large animal. And again, it's sedation and analgesia, but remember I said there's always a reason in a protocol why you're giving a drug. You're giving dexmedetomidine for its sedation, not for its analgesia. But the nice thing is it has some analgesia. The higher the dose, you're going to get more immobilization. And the side effects, besides vomiting, remember these guys, the rodents and the rabbits can't vomit, so we're not worried about that side effect, but you're going to get the bradycardia, the sedation, the respiratory depression, and you can reverse them. Again, yohimbine reverses xylazine, yohimbe awake, and atipamezole, which is antecedent, reverses dexmedetomidine. So the nice thing I like about using alpha-2, some people, you guys have been using them in radiology, so you guys see the bradycardia, but the bradycardia doesn't bother me because it's from hypertension, and usually these dogs are very stable on it, even though you're trained to be like that heart rate is bad. The heart rate is that for a reason. And you know why, because it's because of hypertension. Now, whenever you put an opioid in a protocol, the number one job is for pain. Pre-treat pain before it starts. But again, we usually give an opioid and a sedative because they work together. If you use butorphanol by itself, you're going to have to use a much higher dose, and you're going to get analgesia, and you might see a little bit of sedation, but the main reason you're giving butorphanol is for its analgesic properties. You're not giving it because it's a sedative. But when you use ACE butorphanol together, they enhance each other, and they work much better. So like ACE butorphanol, or you know what, anytime you see butorphanol, you can replace that with buprenorphine. The nice thing, I know Niemer said they used a lot of buprenorphine at her practice, and it's the same theory that I told you in cats. It lasts longer. If I have a stressed out rabbit, I don't want to inject it multiple times a day. If I can give it some pain relief and I can spread it out, everybody's the happier. So by extending these protocols, or by changing that drug, I can, how often do I have to give it? So again, an opioid is always for analgesia, usually combined with a sedative. And I am going to stop there to record the next video.